Welcome to Evidence-Based Practice, Documentation, Informatics, and Teaching. This is part one, which we will focus on evidence-based practice. These are the objectives for this lesson. We're going to identify elements of basic nursing research methods and how it applies to evidence-based practice. We're going to describe the elements of a patient record and legal parameters. We're going to describe guidelines for effective reporting, communication, and documentation. We're going to describe the various uses of technology in nursing, and we're going to discuss teaching and learning principles for patients. Nursing is a profession that is all about knowledge of the human body, the treatments, and then applying that knowledge into the physical care we provide. We've already learned about the nursing process, which is the scientific method for how we plan and implement our care. Now let's focus on the knowledge aspect of how we got to that care and why we do what we do. Because nursing is a healthcare science, everything we do is backed by research. This research has occurred over hundreds of years and continually changes as new evidence and treatments emerge. I like to think of nursing like smartphones. It's always evolving, it's always getting smarter and faster and better. In order for nursing practice to continually change for the better, nurses need to keep learning and gaining knowledge to make improvements. In nursing today, we learn from our instructors, our books, our preceptors, our nurse educators, our providers, and really our entire healthcare team. We also learn from scientific research that's occurring in healthcare. All of these sources are taken into account when we develop our own nursing practice, good or bad. To help improve the good practice nurses have, nursing has created their own nursing research aimed at ending bad practice and encouraging good practice through sharing evidence that the good practices work. The good practices proven to be effective by evidence is called evidence-based practice and is a type of nursing research. Evidence-based practice is nursing care that is supported by sound scientific rationale. This type of research blends the science and the art of nursing to provide the best patient outcomes. Part of evidence-based practice is to take the patient preferences into account. And when doing research, the patient preference is always assumed to be to return to health and functionality. Evidence-based practice is a type of nursing research. Research in general is the process that uses observable and verifiable information collected in a systematic method to describe, explain, or predict events. Research is conducted to validate and refine current knowledge or develop new knowledge. Nursing took research and evolved it to improve the care of people. Nursing research is so important that it is part of our ANA Code of Ethics for Nursing. It states that nurses must participate in knowledge development, evaluations, dissemination, and application to practice. This is what evolved into evidence-based practice. Nursing is no longer a profession that does what it's always been doing. Now we do what is proven to work by research. So why is evidence-based practice important for us nurses? Evidence-based practice is important because we have scientific evidence to back up our care. We are not just doing things because someone told us to do it or because that's the way it's always been done. Evidence-based practice proves that we are a profession that is committed to improving people's lives through scientifically proven methods that will improve the person and not hurt them. We're using science to prevent diseases and disability. We're using science to manage and eliminate symptoms caused by illness. We're using science to treat the whole person in an attempt to improve their lives. There are two main types of nursing research, quantitative and qualitative. Quantitative research involves basic and applied research. Basic research is designed to generate and refine a theory. The findings are often not directly useful in practice on their own, and then applied research is designed to directly influence or improve clinical practice. So we're taking the data we found in the basic research and applying it to clinical practice when we conduct quantitative research. My brain likes to think of quantitative as numbers. There's an N in quantitative, and this type of research gives us numbers and data and concrete information. An example of this would be, what is the best treatment for pressure ulcers? Qualitative research is used to gain insight by discovering meanings to things. It's based on perception and differs from person to person and can change over time. My brain likes to think of qualitative research as the feelings type of research. There's an L in qualitative, and L stands for love, and love is a feeling. We get the feelings and beliefs and ideas from qualitative research. And an example of this would be, how do subjects respond when receiving a cancer diagnosis? When doing quantitative research, we have variables, dependent and independent. Dependent variables are behaviors, characteristics, or outcomes to be explained or predicted. Independent variables are the presumed cause of dependent variables. There's also a hypothesis, which is a predictive statement about the relationship. We're making a guess as to what we think is going to occur. There will be a sample, which may include persons, events, behaviors, documents that we're going to be doing research on. We have to be very mindful of the fact that if our sample includes actual people, those people have rights and must be treated with dignity and respectfully and ethically. We do not do things to intentionally harm people. Samples may have a control group and a study group. The control group has the exact same thing occurring to all of them. Usually it's that nothing is occurring to them. The study group is the group that's going to have the things occur to them. Everything we do is going to give us data, and we're going to take that data and come up with our results. The steps for quantitative research are completed in order. First, we state the research problem, and then we define the purpose of the study. This is the what and why for doing the research. Next, we're going to do a literature review. We do this to make sure that the problem hasn't already been studied, or if it has been studied, we learn from that research that was already done to improve upon what was done or to do something different. Then we formulate our hypothesis and our variables. What do we think is going to happen, and what are our dependent and independent variables? Then we select what type of research design we're going to use. There are different types of research, and some works best for some problems and some work best for others. Then we select our targeted population and our sample. This is the who part of our research. We then do our research, we collect our data from the research, and we analyze the data. This is where we determine if our hypothesis was correct or not. And then after all of this is complete, we're going to communicate the findings and our conclusion. And this process can take days, months, or years, depending on what our problem is. Qualitative research is very different than quantitative. We are not having sample sizes and study groups that we do something to. We're evaluating thoughts and ideas and experiences. We're going to ask a lot of questions. There are 4 types of qualitative research: phenomenology, grounded theory, ethnography, and historical. Phenomenology is when we aim to describe the experiences lived by the people we are studying. This research gives us the meaning of the experience for the people in the study according to their own reality. Grounded theory is discovering how people describe their own reality and how their beliefs are related to their actions. The data is used to generate a theory of the experience. Ethnography is used to determine issues in a culture, and historical research focuses on understanding the events in the past. The steps in qualitative research are almost the same as quantitative, except the data is going to be words and narratives and not numbers and results. There'll be focus groups and interviews and maybe even photos of events and experiences to understand the feelings of the subjects. The way we determine what problem to study and how to study that problem is by formulating our PCOT, or also called PICO, question. Using PCOT helps us really define our study to help us get the results we're looking for. The P stands for patient, population, or problem of interest. This is where we explicitly describe the who and the what. The I stands for intervention of interest. This is the defined thing we want to study, the intervention we want to do. C is the comparison of interest. We usually compare one treatment to another treatment or against the usual standard of care. The T is the time for which the comparison will be completed and the outcome can be evaluated. Some studies don't specifically list a time frame, so that's when you would hear that PICO format. They're the exact same things, just without time. So PICO and PCOT, exact same things. This may sound a little bit like our SMART or Rumba goals because we're trying to be as descriptive and precise as possible so that we have clear evaluation guidelines, just like our nursing process goal and outcomes. So after evidence-based research has been conducted and the data has been reviewed and analyzed, if the research is showing a positive or a beneficial result that would dictate a need to change practice, that information gets published and sent out to scholarly nursing journals. From there, it's usually picked up by a nurse who's reading the articles and who's interested in making the changes at their work. Making the change is not just a change in mindset and doing what the article says. Managers and quality improvement departments need to be involved. Quality improvement is when we make changes to improve the way we deliver our care and our patient outcomes. Most facilities have a quality improvement department and nurses whose jobs it is to improve our care. Any changes we want to make need to involve quality improvement departments. Once managers and quality improvement is involved, some sort of review of data is conducted, and maybe even a research study at the facility is conducted to see if the changes help the populations they serve. The facility needs to make sure that the changes work there and that the patients are not being put in any harm's way. And honestly, this is going to start the whole process all over again. And then once a nurse decides that there is another problem, then they're going to start another research project and get that addressed. And I want you to remember that the person who started to change this practice for better is a nurse. This is you guys. Nurses are the catalyst for evidence-based practice. This is why I say nurses never stop growing and learning. We learn about new things and we act as change agents to get interventions improved, all in an effort to change people's lives for the better. And this is the end of part 1.